Synesthesia. Xiong Chen. DSMV. DSMV stands for Diagnostic and Statistical Manual of Mental Disorders. It is the standard classification of mental disorders used by mental health professionals in the United States. There are 5 axes. Different axial in DSMV. Axis I. Clinical disorders. Diagnostic of major psychiatric disorders. For example, learning disorders and developmental disabilities. Axis II. Personality disorders or mental retardation. Diagnostic of psychiatric disorders present before age 18 that are considered chronic. Axis III. Medical or physical conditions. Diagnostic of medical illnesses to alert a clinician of a potential problem. Axis IV. Contributing environmental or psychosocial factors. Diagnostic in the context of major environmental or social stressors. Axis V. Global assessment of functioning. Diagnostic of the level of functioning. Synesthesia falls in the category of Axis V. Global assessment of functioning. Mental illness percentage. From March 30 to April 11, 2022, approximately 22% of the U.S. population of adults experienced symptoms of depressive disorders. It is equivalent to 50 million Americans. 4 Ds of disorder. Deviance. There are 2 types of deviance, statistical and social. Statistical deviance is when the behavior doesn't occur often in society, while social deviance is when people in a community find the behavior to be odd. Distress. The behavior which causes anxiety, negative feelings, and/or bad feelings from the presence of other people. Dysfunction. An individual suffering from an impairment in a life area, severe enough that they need to seek outside help because of hitting rock bottom. Danger. Behaviors causing the risk of harm to others or themselves. Description. Synesthesia is a type of neurological condition when information stimulates several human senses instead of one. Synesthetes can hear colors, feel sounds, and taste shapes. Each letter has a different color with no particular order in different synesthetes. For example, the color orange may be assigned to the letter A and purple being the letter S. Demographics and statistics. Because synesthesia occurs in the left hemisphere of the brain, women and people who are predominantly left-handed make up the majority of the synesthete population across the globe. 75% of females have synesthesia, while only 25% make up the male population. The ratio from female to male is 3:1. Since synesthesia come in many different forms, the statistics provided is people with color graphemic synesthesia, which is the most common form. Lexical gustatory synesthesia is experienced by only 0.2% of the population, with sufferers tasting flavors across their tongue from sound. Causes. Synesthesia are experienced because of genetic inheritance, being naturally born with the condition. Cases have been known with people developing synesthesia in adulthood, although rare, and the causes of synesthesia are still hard to pinpoint because of little research. However, temporary synesthesia may be developed by using psychedelic drugs, stimulants, and following upon a brain injury. Symptoms. Seeing, hearing a word. Seeing a shape and tasting food. Hearing different sounds, shapes, and/or patterns. Hearing different sounds after smelling a particular scent. Sensation of objects with your hands and hearing sounds. Feeling a touch when seeing someone else being touched. Treatment. People with synesthesia might experience sensory overload, causing issues with stimulating environments because the simulations causes different sensations. People with the condition might be afraid of expressing themselves because of societal norms of acceptance. Treatment can include going to psychotherapy and finding support from friends, family, and lovers. Diagnostic test. Synesthesia can be self-identified by using software websites on the Internet, or by confronting a professional. For example, test number 1. Test number 2. Test number 3. Synesthesia risk factors. Women. People who are left-handed. family history of synesthesia, head trauma, caffeine intake, sensory deprivation, psychedelic drugs. Prevention. Synesthesia has no preventative measures. People experiencing synesthesia encounter enjoyment because of their special abilities that contrasts with the general population. However, they may spiral in isolation because of their differences many cannot understand. Informational videos. Informational videos about synesthesia. Video number 1. Video number 2. Video number 3. Interesting facts. More than 80 types of synesthesia has been identified, but only predominant types has been studied. Many people with synesthesia perform better in terms of academics because of their abilities of color-coding letters and images. Synesthetes don't find their experiences unusual until they discover that others lack the ability. Women and left-handed people are more dominant in developing synesthesia. People working in the creative field are more likely to have synesthesia. 4% of the population have synesthesia. Bibliography.